the Community Good Health Program, Dr. Mupen's group has always been committed to the population and to their good health, and has always been in the forefront, creating awareness towards one of the most deadly diseases: cancer. Our motive is to make our planet Earth cancer-free.
Thank you very much for joining the Dr. Mupen's group in this crusade against cancer. Cancer, as all of us know, is really something which is fearful to people. But we should understand that cancer, if detected early, is eminently treatable. So the person has to take that initiative, or people close to him or her has to take that initiative. In this particular campaign, we are laying stress on breast cancer, which is the most fatal malady affecting the women's folk of our society. We find even people in the medical profession, like nurses or even doctors, getting affected, telling us that the awareness has to improve tremendously for this to go into the people's mind and aid prevention. So as a social commitment to the society, we have taken up the responsibility of highlighting the importance of detecting breast cancer, which is very, very simple. So my request is to get involved in this campaign and be a part of that, and see whether you yourself and your close people are afflicted by this and take advantage of this campaign. Thank you very much for cooperating with the campaign and with Dr. Mupen's group.
Cancer sounds scary, but it may not be that scary if detected at an early stage. The fear towards cancer left most of us unknowing of what cancer actually is.
Cancer is the word which is used to describe a group of diseases in which the cell in the human body can grow and change in the size and shape, and it multiply with a way that it will be out of control. And these defective cells, the malignant cells, we call it a malignant cell, will invade the healthy structure and will destroy it. It also can travel by lymphatic and the bloodstream to far organ, healthy organ, and affect the function of this organ. There are hundreds of different types of cancer which can affect the human being, and most of them named after the organ or the cell which is originate. The breast tissue, when it's affected by this, it will give us a breast cancer.
As they say, get scared to be aware. Get scared of breast cancer. And if anyone of your friends or family has any of the symptoms of breast cancer or history of cancer in the family, make them aware too.
When we talk of breast cancer, lot of queries come in our mind, many of which are myths. Does breast cancer occur only in women after menopause? No, not really. Breast cancer can affect women of all ages, but the risk increases as we get older, and that is why the American Cancer Society recommends women over 40 years should have an annual mammogram. A mammogram picks up cancer much earlier than it can be detected by clinical examination, that is, even before a lump is felt in the breast. Can I get breast cancer if there is no family history? A family history does definitely increase the risk, But about 80% of women who are diagnosed to have breast cancer do not have any identifiable risk factors like a strong family history. Does using oral contraceptive pills increase the risk of breast cancer? Basically, oral contraceptive pills use very low dose of hormones, so the risk is very negligible. There is a lot of apprehension when postmenopausal women are counseled about starting hormone replacement therapy for their symptoms. HRT use for many years may increase the risk of breast cancer, but once the hormone replacement therapy is stopped, the risk almost comes back to the baseline after stopping treatment. Many women have benign breast disease like fibrocystic disease of the breast. So the common query asked to us is, Doctor, does this lead to cancer? They are very, very apprehensive about this. The good news is that many women do have this problem in some time of their lives. So this does not lead to breast cancer. Is stress related to breast cancer? One can be relieved that there is enough research which shows no direct link between stress and breast cancer. Every woman is different, so she should consult her doctor and discuss the risk factors which she has and then plan out a protocol as to when she should start screening for breast cancer and how often she should do it.